Assalamu and hello everyone, welcome back to the channel. I hope that you are all doing very well. In today's video we are going to talk about endometriosis. I'm going to talk about what is endometriosis. I'm going to talk about the symptoms you might experience with endometriosis. I'm also going to talk about why it's difficult to diagnose endometriosis, as well as some of the causes that can be seen with endometriosis. Of course, I'm going to jump into treatment options for endometriosis. I'm going to spend a little bit of time talking about endometriosis with perimenopausal women, and of course how to advocate for yourself. Now let's first dive into what is endometriosis. Now, according to the American Medical Association Journal of Ethics, about 6 to 10% of women, roughly over 170 million women, they stated, are affected by endometriosis, and this is a lot of women. Endometriosis is problematic because this is tissue that is found around the fallopian tubes, the ovaries, the bladder, and even the intestine, but it looks a lot like uterine lining tissue. So this looks like the lining of the uterus. Now, if you're familiar with the lining of the uterus and you know what happens with the lining of the uterus, every month or every 24 to 40 days, we have the lining of the uterus building upon itself in expectation for implantation. But if that doesn't happen, that blood is shed and it is removed from the body. With endometriosis, there's nowhere for that blood to go. So often you see inflammation with certain women who have endometriosis. And that's why it's really a problem, because it mimics the uterine lining tissue, but it doesn't get shed the way the uterine lining tissue gets shed every month. Now, some of the symptoms that are seen with women who have endometriosis include period pains that are beyond their normal period cramps. And I say normal is because some women's period cramps during the month is pretty brutal, but this is going to be excessive of that. Also, pain after intercourse is seen. Another symptom that is seen is bloating, which might mimic digestive issues, but it's really not. Bloating, as well as fatigue, and also periods that are longer than normal. Now, normal periods would be anywhere from 2 to 7 days, but in this particular case, we're seeing periods that are above 7 to 8 days. Now, why is it difficult to diagnose? There are two main reasons that I found through literature that it is difficult to diagnose. And of course, there are many more, but the two I want to mention today is, number one, painful periods are normalized, and that should not be the case. Often women are dismissed when they present with pain, and it's unfortunate because it could be more than just period cramps. A second thing is that it's often difficult to diagnose because symptoms and the way endometriosis presents with the bloating. It's often misdiagnosed as some women having a digestive issue, like irritable bowel syndrome, for example. And so that is some of the more common reasons why endometriosis is being misdiagnosed in women. Now, in terms of the cause of endometriosis, know that it is considered estrogen dependent. And when you have estrogen dominance or estrogen dependence, you see how that plays out. And I'll leave a link to this video here to show that estrogen is a very important hormone. It's considered the queen bee of the hormones, but if you're dominant in that hormone, or even if you lack that hormone, there are certain things that you would see that can cause a lot of problems in terms of how your body is regulating itself. Also know that genetics has been thought to play a role in endometriosis. However, that is not conclusive, and more information is coming out with regards to research behind whether genetics really does play a role. Now, of course, the treatment options is something that I want to dive in as well. With treatment options, there are multifold. We're talking about things like NSAIDs or oral contraceptives to help minimize the bleeding month to month. Then you also have things like gonadotropin antagonist agents, which I've also talked about in my fibroid video here, and that is because we want to reduce the amount of follicle stimulating hormones and luteinizing hormones released from pituitary gland, and in effect you reduce the amount of estrogen that is going to be released from your ovaries. And then there's one of the last resorts that includes surgery. Now, with regards to women who are in the perimenopausal stage of life, we understand that estrogen is fluctuating We have moments of high estrogen, medium estrogen, low estrogen, and this from month to month can cause a lot of disruption and a lot of confusion with our cycles, with how we're feeling, with our, with perimenopausal symptoms like mood swings, night sweats, hot flashes, things of that nature. One of the things I want to remind you is that estrogen is fluctuating, and there are moments and times when the estrogen might be dominant, which I mentioned before, and that can lead to times where you might experience endometriosis. So it's going to be important for you to work directly with your provider so that you understand how to manage your symptoms better. And of course, I spoke about the treatment options. In the end, what you want to try and do is do your best to track your symptoms and advocate for yourself. I've already spoken about how women's period pains are often dismissed and normalized. They might be told to take an over-the-counter NSAID, but it might be deeper than that. So I want you to do your best to advocate for yourself if something doesn't feel right. You know your body best, and so that's what I'm pushing for you. I hope that the information in this video has been beneficial. I know that I often ask you to leave a comment and with requests on what topics you want to talk about, and I'm going to continue to do that today. So again, leave a comment. What do you want to talk about? What do you want to discuss? What is pressing for you on your health journey? And let's dive in. Let's dig into it so that we can bring more awareness to some of these issues that many women might be experiencing, but they might not know enough about. Then I'll also leave some links to some healthy, tips below, and, some health guides and things that will be beneficial for you. I'm also going to leave a link to my perimenopausal guide. It's a quick guide that I created that gives you a very high level overview of the menopausal transition and things you need to really start to look out for in terms of bone health, brain health, heart health, muscle health. So I will leave that in the description below. So I do thank you for watching, and I shall see you in the next video. Take care. Bye.